Question 1. A client with major depression says, "Life is not worth living anymore." What is the nurse's priority response? A. Why do you feel that way? B. You should try to think positively. C. Are you thinking about hurting yourself? D. Everyone feels sad sometimes. Correct answer. C. Are you thinking about hurting yourself? Rationale. The nurse should first assess for suicidal thoughts because safety is the priority in mental health care. Strategy. When a client mentions hopelessness or death, always assess suicide risk first. Question 2. A client diagnosed with schizophrenia says, "The television is talking directly to me." How should the nurse respond? A. That must be frightening for you. B. The television cannot talk. C. You are imagining things. D. Why do you think the TV talks to you? Correct answer. A. That must be frightening for you. Rationale. The nurse should acknowledge the client's feelings without reinforcing the hallucination or delusion. Strategy. Do not argue with psychotic clients. Focus on feelings and reality-based communication. Question 3. A manic client is constantly talking and interrupting others. What is the nurse's best action? A. Encourage group activities. B. Tell the client to remain quiet. C. Use short, firm directions. D. Ignore the behavior. Correct answer. C. Use short, firm directions. Rationale. Clients experiencing mania have poor concentration and need simple, clear communication. Strategy. For mania, keep communication brief, calm, and structured. Question 4. A client with generalized anxiety disorder is hyperventilating. What should the nurse do first? A. Teach relaxation exercises. B. Ask the client to breathe slowly. C. Leave the client alone. D. Give caffeine. Correct answer. B. Ask the client to breathe slowly. Rationale. Slowing breathing helps reduce hyperventilation and anxiety symptoms immediately. Strategy. Address physiological symptoms first during panic or anxiety attacks. Question 5. A client taking lithium reports diarrhea and muscle weakness. What should the nurse suspect? A. Lithium toxicity. B. Dehydration only. C. Anxiety reaction. D. Expected side effect. Correct answer. A. Lithium toxicity. Rationale. Diarrhea and muscle weakness are early signs of lithium toxicity. Strategy. Remember lithium toxicity signs: diarrhea, tremors, confusion, and weakness. Question 6. A nurse is caring for a client experiencing alcohol withdrawal. Which symptom requires immediate attention? A. Tremors. B. Sweating. C. Hallucinations. D. Mild anxiety. Correct answer. C. Hallucinations. Rationale. Hallucinations may indicate severe withdrawal and risk for delirium tremens. Strategy. Prioritize severe neurological symptoms in withdrawal clients. Question 7. A client says, "I hear voices telling me to hurt myself." What is the nurse's priority action? A. Ask what the voices are saying. B. Tell the client to ignore the voices. C. Leave the client alone. D. Change the subject. Correct answer. A. Ask what the voices are saying. Rationale. The nurse must assess if the hallucinations are command hallucinations that may lead to harm. Strategy. Assess safety whenever hallucinations involve self-harm or violence. Question 8. A client with obsessive-compulsive disorder repeatedly washes hands. The nurse should A. Stop the behavior immediately. B. Allow time for the ritual initially. C. Punish the behavior. D. Ignore the client. Correct answer. B. Allow time for the ritual initially. Rationale. Suddenly stopping compulsive rituals increases anxiety. Strategy. Gradually limit compulsions while promoting healthier coping methods. Question 9. A client with depression refuses to eat. Which nursing action is best? A. Force the client to eat. B. Offer small frequent meals. C. Remove the meal tray immediately. D. Ignore the refusal. Correct answer. B. Offer small frequent meals. Rationale. Small meals are easier for depressed clients who have low appetite and energy. Strategy. Use simple nutritional interventions for depressed clients. Question 10. A client experiencing a panic attack says, "I feel like I'm dying." What is the nurse's best response? A. You are safe. I will stay with you. B. Calm down immediately. C. Nothing is wrong with you. D. Stop overreacting. Correct answer. A. You are safe. I will stay with you. Rationale. Remaining calm and staying with the client helps reduce fear and anxiety. Strategy. During panic attacks, use calm reassurance and stay with the client. Question 11. A client with bipolar disorder suddenly becomes extremely cheerful and energetic after severe depression. What should the nurse assess first? A. Sleep pattern. B. Suicide risk. C. Appetite. D. Hygiene. Correct answer. B. Suicide risk. Rationale. Sudden mood improvement may mean the client now has energy to attempt suicide. Strategy. Always monitor suicide risk during mood changes. Question 12. A client diagnosed with anorexia nervosa has a BMI of 15. What is the nurse's priority concern? A. Body image disturbance. B. Social isolation. C. Fluid and electrolyte imbalance. D. Family conflict. Correct answer. C. Fluid and electrolyte imbalance. Rationale. Severe malnutrition can cause life-threatening electrolyte problems. Strategy. Prioritize physiological stability before psychosocial issues. Question 13. A client with PTSD becomes anxious after hearing loud noises. The nurse recognizes this as A. Projection. B. Trigger reaction. C. Delusion. D. Mania. Correct answer. B. Trigger reaction. Rationale. Trauma reminders can trigger anxiety and flashbacks in PTSD clients. Strategy. Identify triggers that worsen PTSD symptoms. Question 14. A client taking antipsychotic medication develops muscle rigidity and high fever. What should the nurse suspect? A. Serotonin syndrome. B. Neuroleptic malignant syndrome. C. Panic attack. D. Withdrawal symptoms. Correct answer. B. Neuroleptic malignant syndrome. Rationale. Muscle rigidity and fever are classic signs of neuroleptic malignant syndrome. Strategy. NMS is a medical emergency linked to antipsychotics. Question 15. A client says, "I cannot leave my house because something terrible will happen." This is an example of A. Mania. B. Agoraphobia. C. Delusion. D. Hallucination. Correct answer. B. Agoraphobia. Rationale. Agoraphobia involves fear of leaving safe environments. Strategy. Identify anxiety disorders by their characteristic fears. Question 16. A nurse notices a client pacing and clenching fists. What is the nurse's priority action? A. Confront the client. B. Assess for escalating violence. C. Ignore the behavior. D. Restrain immediately. Correct answer. B. Assess for escalating violence. Rationale. Pacing and clenched fists are warning signs of possible aggression. Strategy. Recognize early signs of violence to prevent escalation. Question 17. A client with depression sleeps most of the day. Which activity is most appropriate? A. Competitive sports. B. Simple structured activities. C. Isolation in room. D. Long lectures. Correct answer. B. Simple structured activities. Rationale. Structured activities help improve mood without overwhelming the client. Strategy. Encourage gradual participation in manageable activities. Question 18. A client taking benzodiazepines should be taught to avoid A. Milk. B. Exercise. C. Alcohol. D. Fruit juice. Correct answer. C. Alcohol. Rationale. Alcohol increases CNS depression when combined with benzodiazepines. Strategy. Remember dangerous drug interactions with sedatives. Question 19. A client with schizophrenia suddenly stops taking medication. The nurse should expect A. Improved concentration. B. Return of psychotic symptoms. C. Increased appetite. D. Rapid recovery. Correct answer. B. Return of psychotic symptoms. Rationale. Stopping antipsychotic medication often causes relapse. Strategy. Medication adherence is critical in schizophrenia treatment. Question 20. A client with severe anxiety cannot concentrate during teaching. What should the nurse do? A. Continue detailed teaching. B. Postpone teaching until anxiety decreases. C. Speak loudly. D. Test the client immediately. Correct answer. B. Postpone teaching until anxiety decreases. Rationale. Severe anxiety limits the ability to learn and process information. Strategy. Do not teach during high anxiety states. Question 21. A client states, I wash my hands 50 times a day to prevent germs. This behavior is A. Hallucination. B. Compulsion. C. Delusion. D. Conversion reaction. Correct answer. B. Compulsion. Rationale. Compulsions are repetitive behaviors performed to reduce anxiety. Strategy. Obsessions are thoughts, compulsions are actions. Question 22. A client with borderline personality disorder threatens self-harm when upset. What is the nurse's priority? A. Ignore the statement. B. Assess suicide risk. C. Argue with the client. D. Leave the client alone. Correct answer. B. Assess suicide risk. Rationale. All threats of self-harm must be taken seriously. Strategy. Safety always comes first in mental health nursing. Question 23. A client reports difficulty sleeping after experiencing trauma. Which disorder is most associated with this symptom? A. OCD. B. PTSD. C. Bipolar disorder. D. Schizophrenia. Correct answer. B. PTSD. Rationale. Sleep disturbances are common in PTSD. Strategy. Think PTSD when trauma history and hyperarousal symptoms appear together. Question 24. A client says, the FBI implanted a chip in my brain. This statement is an example of A. Illusion. B. Delusion. C. Compulsion. D. Phobia. Correct answer. B. Delusion. Rationale. A delusion is a fixed false belief not based in reality. Strategy. Delusions are false beliefs, hallucinations are false sensory perceptions. Question 25. A nurse is caring for a suicidal client. Which item should be removed from the room? A. Blanket. B. Plastic cup. C. Shoelaces. D. Pillow. Correct answer. C. Shoelaces. Rationale. Shoelaces can be used for self-harm. Strategy. Remove all potential ligature or harmful objects from suicidal clients. Question 26. A client with mania refuses to sit for meals. What is the best nursing intervention? A. Offer high-calorie finger foods. B. Force large meals. C. Restrict fluids. D. Encourage long naps. Correct answer. A. Offer high-calorie finger foods. Rationale. Manic clients are often too active to sit still for meals. Strategy. Provide portable, nutritious foods for hyperactive clients. Question 27. A client with social anxiety disorder fears speaking in public. The nurse understands this fear is A. Rational and normal. B. Excessive and persistent. C. Temporary confusion. D. A hallucination. Correct answer. B. Excessive and persistent. Rationale. Social anxiety involves intense fear of social situations and embarrassment. Strategy. Phobias and anxiety disorders involve excessive fear responses. Question 28. A client taking SSRIs should be monitored for which serious condition? A. Serotonin syndrome. B. Kidney stones. C. Hearing loss. D. Cataracts. Correct answer. A. Serotonin syndrome. Rationale. SSRIs can cause serotonin syndrome, especially when combined with other serotonergic drugs. Strategy. Watch for agitation, fever, sweating, and confusion with SSRIs. Question 29. A client experiencing grief says, "I still cannot believe my loved one is gone." Which stage of grief is this? A. Acceptance. B. Anger. C. Denial. D. Bargaining. Correct answer. C. Denial. Rationale. Denial involves difficulty accepting the loss. Strategy. Know the stages of grief for NCLEX questions. Question 30. A nurse is communicating with a paranoid client. Which approach is best? A. Whisper to other staff members. B. Use clear and honest communication. C. Joke frequently. D. Touch the client often. Correct answer. B. Use clear and honest communication. Rationale. Paranoid clients need consistent and trustworthy communication. Strategy. Avoid behaviors that increase suspicion in paranoid clients. Question 31. A client with schizophrenia is withdrawn and avoids eye contact. These symptoms are classified as A. Positive symptoms. B. Negative symptoms. C. Cognitive symptoms. D. Panic symptoms. Correct answer. B. Negative symptoms. Rationale. Withdrawal and poor eye contact are negative symptoms of schizophrenia. Strategy. Positive symptoms add behaviors, negative symptoms reduce normal behaviors. Question 32. A client says, "I feel anxious whenever I am in crowded places." Which disorder is most likely? A. Agoraphobia. B. OCD. C. Bipolar disorder. D. Dissociative disorder. Correct answer. A. Agoraphobia. Rationale. Agoraphobia involves fear of places where escape may be difficult. Strategy. Associate crowd fear with agoraphobia. Question 33. A nurse is caring for a client having auditory hallucinations. Which intervention is best? A. Encourage the client to discuss the voices. B. Tell the client the voices are real. C. Isolate the client. D. Argue with the client. Correct answer. A. Encourage the client to discuss the voices. Rationale. Discussing hallucinations helps assess content and promotes trust. Strategy. Assess hallucinations without validating them. Question 34. A client with depression says, "I deserve to suffer." This statement reflects A. Grandiosity. B. Low self-esteem. C. Mania. D. Confabulation. Correct answer. B. Low self-esteem. Rationale. Feelings of worthlessness are common in depression. Strategy. Look for negative self-thoughts in depressed clients. Question 35. A client suddenly becomes aggressive in the day room. What should the nurse do first? A. Restrain the client immediately. B. Maintain safety for everyone. C. Leave the area. D. Argue with the client. Correct answer. B. Maintain safety for everyone. Rationale. Safety is always the first priority during aggressive behavior. Strategy. Think safety first in psychiatric emergencies. Question 36. A client with panic disorder reports chest pain and dizziness. The nurse should first A. Ignore the symptoms. B. Assess physical status. C. Tell the client to relax. D. Leave the client alone. Correct answer. B. Assess physical status. Rationale. Physical causes must be ruled out before assuming anxiety. Strategy. Assess ABCs and physical conditions first. Question 37. A client taking MAOI should avoid foods high in A. Calcium. B. Tyramine. C. Potassium. D. Vitamin C. Correct answer. B. Tyramine. Rationale. Tyramine can cause severe hypertension with MAOIs. Strategy. Remember, MAOI plus tyramine equals hypertensive crisis. Question 38. A client diagnosed with bulimia nervosa is most likely to A. Avoid eating completely. B. Have recurrent binge eating. C. Refuse all fluids. D. Exhibit hallucinations. Correct answer. B. Have recurrent binge eating. Rationale. Bulimia involves binge eating followed by compensatory behaviors. Strategy. Differentiate bulimia from anorexia. Question 39. A client with depression has poor hygiene. What is the nurse's best response? A. Criticize the client. B. Assist with simple self-care tasks. C. Ignore hygiene. D. Demand independence. Correct answer. B. Assist with simple self-care tasks. Rationale. Depressed clients may lack energy for self-care. Strategy. Encourage independence gradually. Question 40. A client experiencing alcohol withdrawal becomes disoriented and restless. What condition should the nurse suspect? A. Delirium tremens. B. Mania. C. Panic attack. D. OCD. Correct answer. A. Delirium tremens. Rationale. Disorientation and severe withdrawal symptoms suggest delirium tremens. Strategy. DTs are life-threatening and require urgent care. Question 41. A client says, I feel empty inside all the time. This symptom is commonly associated with A. Borderline personality disorder. B. Dementia. C. Autism. D. Delirium. Correct answer. A. Borderline personality disorder. Rationale. Chronic feelings of emptiness are common in borderline personality disorder. Strategy. Recognize emotional instability patterns. Question 42. A nurse is teaching a client taking lithium. Which instruction is important? A. Restrict fluids. B. Maintain consistent salt intake. C. Avoid all exercise. D. Skip doses when feeling better. Correct answer. B. Maintain consistent salt intake. Rationale. Changes in sodium levels can affect lithium levels. Strategy. Lithium and sodium balance are closely related. Question 43. A client with schizophrenia displays word salad. This indicates A. Organized thinking. B. Disorganized speech. C. Memory improvement. D. Appropriate communication. Correct answer. B. Disorganized speech. Rationale. Word salad is meaningless mixed speech linked to severe thought disorder. Strategy. Recognize altered thought processes in schizophrenia. Question 44. A client who survived a traumatic accident reports flashbacks. The nurse recognizes this as A. PTSD symptom. B. Mania symptom. C. OCD behavior. D. Delusion. Correct answer. A. PTSD symptom. Rationale. Flashbacks are common in PTSD. Strategy. Trauma plus flashback strongly suggests PTSD. Question 45. A nurse notices a client is trembling and sweating before an exam. Which level of anxiety is likely? A. Mild. B. Moderate. C. Severe. D. Panic. Correct answer. B. Moderate. Rationale. Moderate anxiety increases physical symptoms but still allows learning. Strategy. Know anxiety levels and their effects. Question 46. A client taking antipsychotics develops lip smacking and tongue movements. What should the nurse suspect? A. Tardive dyskinesia. B. Panic disorder. C. Neuroleptic malignant syndrome. D. Delirium. Correct answer. A. Tardive dyskinesia. Rationale. Abnormal involuntary movements are signs of tardive dyskinesia. Strategy. Monitor long-term antipsychotic use carefully. Question 47. A client with severe depression remains silent during conversations. This is known as A. Echolalia. B. Mutism. C. Perseveration. D. Flight of ideas. Correct answer. B. Mutism. Rationale. Mutism is the inability or refusal to speak. Strategy. Recognize altered communication patterns. Question 48. A nurse is caring for a paranoid client who refuses medication. Which response is best? A. You must take this now. B. This medication can help reduce your stress. C. If you refuse, you will be punished. D. There is nothing wrong with you. Correct answer. B. This medication can help reduce your stress. Rationale. Simple, honest explanations help reduce suspicion. Strategy. Avoid power struggles with paranoid clients. Question 49. A client with mania spends excessive amounts of money. This behavior reflects A. Poor judgment. B. Hallucination. C. Withdrawal. D. Confusion. Correct answer. A. Poor judgment. Rationale. Impulsive spending is common during manic episodes. Strategy. Watch for risky behaviors in mania. Question 50. A nurse is caring for a suicidal client on one-to-one observation. Which action is appropriate? A. Leave the client alone during meals. B. Maintain continuous observation. C. Allow access to sharp objects. D. Check the client every 4 hours. Correct answer. B. Maintain continuous observation. Rationale. One-to-one observation requires uninterrupted monitoring for safety. Strategy. Suicidal precautions must be followed strictly.